but fact checker and science book and helping people who are scared of things. And this time it's about the very last press briefing of the World Health Organization that they gave just yesterday. And the journalists, as they always do, put a very gloomy spin on it. They've been doing that all the way along through. And I want to just kind of give another take on it. And first of all, what they actually said is that it's a question, can we eradicate with a vaccine? They didn't actually say that we can't eradicate with a vaccine. Or could it become an endemic disease? Indeed, that we can manage with vaccination and therapeutics. So let's start by looking at what Mike Ryan actually said. So he said, and the first and primary objective is to decrease the impact of the disease on people's lives. That would be a major step forward in bringing the world back to some kind of normal. And this we will see really early next year, because they're going to be vaccinating a lot of the most vulnerable people, so their risk of death will go right down, and the risk of severe disease will go right down. The vaccine doesn't stop that completely, but it will reduce it hugely. And then the second phase is looking at how will this vaccine affect transmission. And he says that we just don't know yet. He didn't say that it won't be able to stop transmission. He just don't know yet about the length of the practitioner and other things to be absolutely able to predict that. But he thinks we should be able to get good control of the virus. So we could certainly bring the cases per day way, way down. That's absolutely sure. I'm pretty certain. And then we know that even without a vaccine we can end it, as New Zealand did and several other countries, and China of course. And then he says that the decision to move towards elimination or eradication requires a much higher degree of efficiency and effectiveness in the vaccination program, and all the other control measures, so we do the other things as well. And we still don't know, based on virus evolution, based on so many other things. So what he's talking about there is that we don't yet know quite, we only have very preliminary data about whether the vaccine stopped transmission. And there were some rather disappointing early results from AstraZeneca. They found that if you have the 2 full doses, then you got only 4% reduction of the, which is not very much, in the actual number of cases, if you include both asymptomatic as well as the symptomatic cases. Much higher reduction if you include symptomatic cases, then even with the low dose and then the high dose, which was the accidental test that they did, just through a slip up in the way they measured something. And so they ended up giving quite a few people this low dose first. And that was much more effective in stopping the vaccine. It was also much more effective in stopping transmission, but although they got 90% of reduction of the symptoms, they only got 59% reduction of the of all cases, including ones that had very mild symptoms or asymptomatic. Not so mild they didn't report themselves as having possible COVID. So that 59% is not enough to stop it with an R0 of 2.5. It would be plenty to stop it with an R0 of 1.5, 1.25, but not with an R0 of 2.5. And then we have the possibility of this new variant, which this new variant is maybe more transmissible. Now, you get the journalists and presenters on television saying it is more transmissible. That's not proven at all. Personally, I'm quite sceptical about it. But who am I to say? But what we can say for sure is that the science isn't in there yet. We have several weeks to a month or maybe longer before we have the science in as to whether we know whether it really is more transmissible, and if it is. So Mike Ryan said maybe it's a little bit, but maybe it's a bit somewhere between the 1.1 and the 1.5. That it could be partly due to other things and partly it is to some extent more transmissible. And so we don't know how much it is. So that's what Mike Ryan said. So he knows what he's talking about. So it could be somewhere between the two rather than being all the way up at 1.5. And so we just don't have that information yet. So it's all that concerning. So then you start thinking the likely scenario is it will become, as the scientist said, another scientist said previously, another endemic virus, somewhat of a threat, but a very low level threat in the context of an vaccinate enough people. But it remains to be seen how well the vaccines are taken up and also that, and how close we get to a coverage level that might allow us to go to elimination or eradication. And then he's talking about previous experience with polio and measles. So he said we first of all have to focus on getting good control on the epidemic so we can return to normal. And then we've got to deal with the moonshot of potentially being able to eliminate this vaccine. But at this point, based on the tools we have and the knowledge we have, and that's impossible to say at this point. So he didn't say that we can't eradicate it. He didn't say it's going to be endemic. He said it's just impossible to say at this point. And that, the journalists are not really reporting it quite like that. So that's the one thing I wanted to correct. And then I'd give a little bit of the context of all this. And so, first of all, on the transmission, then it seems becoming more transmissible. We don't know. I'm not going to go. I'll talk about it in a separate video about whether it is or not. Just say we don't know at this point. But it does seem to be evolved. One thing we can say is about how fast it's evolving. So coronaviruses are really rather stable. They don't evolve rapidly like flu. But this was a sudden appearance of one that had 14 or 22 mutations, depending how you measure it, just in one case. And so this brings up a new possibility of rather faster evolution, where they think it probably could be due to a chronic, they don't know, where it wouldn't needn't necessarily have arisen in the United Kingdom. We may have been first to detect it. But I think just from looking at the pattern of the changes, there may have been a single chronically infected case that just couldn't get rid of the virus for long periods of time and was still infectious until weeks, months or longer, and then gradually as the virus was fighting back against the immune system, then it developed lots and lots of new mutations. And so if that sort of thing is going on, they can evolve a little bit faster than they previously thought, but not nearly as fast as flu, but faster than measles for sure, where the vaccine from decades ago still works, and somewhere between the two. Now, there's another little bit of evidence. So if this is correct, it's not going to escape the vaccine all of a sudden. You don't need to worry about that. I talked about that previously. But that's talking about years in the future probably, and even if it happens over months, then and we don't know how long it's going to be. The immune period lasts. I think probably it's going to be 6 months, more than 6 months, maybe a year, maybe 2 years. We'll see. But if the vaccine has a short period, and then if the virus is escaping the vaccine, they'd have to replace the spike in the vaccine, and then you'd have to vaccinate everyone again, which you'd have to do anyway if there's a shorter immune period. So if you're being pessimistic, you start thinking like that. If you're being optimistic, then it's going to be a year, 2 years, and the vaccine is going to take a long time virus is going to take a long time to escape. But we can replace the spike very quickly, much quicker than we originally developed the vaccine. So we can continue to vaccinate everyone. Don't need to worry that you're not going to be able to be vaccinated. There's a possibility of vaccination gradually losing some of their effectiveness and having to be a reboost of the vaccine. And then there's this example from OC43, which I found by pulling up some links and some clues and things from what they were saying. Then this has very close resemblance to bovine coronavirus, and this is a common cold in humans that is, for most people, it doesn't have much of an effect on you. And it's one of the 16 common colds and one of the 4 that the coronavirus is. This jumped to humans in sometime in the 19th century, they're pretty sure. And their best guess of the date is 1890. And they do that by looking at the molecular clock of how fast it evolves and how different it is from bovine coronavirus. So if it jumped about 1890, then it so happens there was a disease of cattle around then, which could have been this bovine coronaviruses. They don't have these tissue samples to be able to test. And then they had to cull lots of them. The people involved in the culling could have got infected by the cattle, and then that could have been a reason why one of them made the jump, and there's some mutation that let it jump to humans. So this, in a way, it's quite good news in a way, because that was obviously, if it was, and there was a pandemic in 1890, which could have been flu. There's some evidence that antibodies for H2N2 in very elderly people who survived that pandemic, and when we could all still test for antibodies, and they were still alive. In 1890, there could still be very few people still. No, I don't think any would be around now, but there were people they could test for antibodies that found H2N2 back when they were still alive. So that's indirect evidence there could be H2N2 flu, but it could alternatively have been this OC43, and it had symptoms that were unusual, neurological symptoms that were unusual for flu. So the upshot of all that is that could possibly have been this bovine coronavirus. If so, it was actually quite serious back in 1890 and caused significant neurological symptoms. And the things about bovine coronavirus in humans, the OC43, it has the capability to attack the neural network. It's got that capability as part of the virus of our neural system. And so it just clues, but it could just possibly, that could have been that disease. If so, then it evolved from something serious over decades to something that was really nothing at all. That's quite a fast change. And so the combination of those two is kind of a bit optimistic if it does become endemic. That it could just become another common cold over a period of decades, and meanwhile we can manage it with the vaccines and with therapeutics, and we could keep the numbers very low, just like it is for measles, or something like that, keep numbers very low in countries, so that you get a few severe cases, but as long as everyone's vaccinated, and if you go in hard like we do whenever you do get a cluster like Australia's done, for instance, then we can maybe keep it well down. So that's one possibility. But the other possibility is that we do find a very effective, that later more work, we can find a vaccine that stops transmission. So looking at this mathematically, with my mathematician's eye, it's a huge difference from 4% to 59%. And it seems extremely unlikely that that 59% is optimal. With the very first vaccine they test, and a serendipitous test where you had a half dose first of that vaccine, seems exceedingly unlikely that would hit on the optimal combination for stopping transmission. And looking at a big difference from 4% to 59%, then seems reasonably plausible that 80, 70, 80%, maybe even 90%, it's not impossible that's within the window still of what could be done with stopping transmission. And they're already going to try AstraZeneca with the Russian vaccine, the Sputnik vaccine, because part of the reason why the half dose started first may have helped is because it may be that the second dose is less effective because of the immune system stopping the delivery system, which is the adenovirus, attacking adenovirus before it can deliver the DNA to the core of your cells, which then turns into messenger RNA, which turns into spikes. And if that is stopped very early on by attacking the adenovirus, then you never get the spikes, and so your body never tries to fight against the spikes particularly, and instead fights against the adenovirus that is delivering them. So it could well be that the vaccine, that having a different delivery system, that you've got delivery system for the Russian Sputnik one, and then it delivers antibodies against the delivery system, then the delivery system of the adenovirus from chimpanzees, which is that one's based on a human adenovirus, this one adenovirus from chimpanzees, and then using that one's delivery system, then it might be much more effective with a two-dose regime. So lots of ways that even AstraZeneca can be more effective, and they can play with different doses and so on. And it seems exceedingly unlikely that 59% is the absolute optimum. And then we have Pfizer, which is better than AstraZeneca at 95% for its stopping of symptomatic cases. So That's quite a lot better. If you look at the ones, the remaining cases dropped from 10%, it's half them 10% to 5%. And if you look at, say, the 59% and drop and half the remaining one, the 40% to 20%, then you get to 80%. So it's not impossible that Pfizer is 80% just based on this example. So it just I'm just looking at it like a mathematician. I look at the numbers. That's my background, is mathematics. I look at the numbers, and so then I want to look at, again, mathematical background. Look at the R0 figures, and so if you look at them so if we look around the world, we've got lots of countries that are close to containing it, but it's going up gradually, and then eventually can manage to bring it down again. And this is where it becomes very much more sociology than science. It's a case of, so if you look at it now, I'm very pleased to see that all except 6 of the US states now have an R0 less than 1. And it's, if you look at these figures, a 5% difference, then even at 4% effective vaccine, if you look at, say, Maine, then a 4% effective vaccine to a large proportion of the population would bring that down to an R0 less than 1. So then you'd have only these two. And then if you've got 59% effective, then you'd bring even California, and then you'd vaccinate, say, 80% or something, 90%, then that would bring down, that would halve the Californian number, and that would go down as fast as it did in New Zealand. So if you are starting to look about what people are actually doing now, and sadly they're doing it very much with quite strong measures of lockdown, but if they're not doing, I don't think they're doing full lockdown in California. In fact, they're not really doing, they're doing lockdown in the UK, but not so much in the United States. They're doing things like closing restaurants and stuff, and they're doing things like physical distancing and wearing masks. So if you can have that much more compliance with that, that's what they're getting with a lot of people not complying. So there are two kinds of people in the United States. Some people are very careful, and I talk to them by PM, and some people are just not taking, I talk to people like that as well, just hardly not taking many precautions. And so these two kinds of people, the journalists have been focusing very much on the ones who are not complying, and that I think has had an effect, sociological effect, on the United Kingdom as well. People just seeing people on TV day after day not wearing masks, not physically distancing, and having a natural liking to mix with other people without physical distancing. And it's no wonder that has an effect on us on a not very logical level. And so having the World Health Organization has talked about how it's important to quarantine politics, and sadly it said that in April, Dr. Tedros did, very foresighted, and based on their previous experience obviously, but we haven't, and we've had these huge political divides about whether to wear masks or not, which shouldn't have been a political thing at all, and about physical distancing, just normal sensible things to deal with a disease like this. So once we have something much more consistent with Joe Biden in the United States leading from the top, giving constant messages and talking directly to the public, like Jacinda Ardern did that in New Zealand, but her broadcasts were not much played outside of New Zealand unless you're very interested in following them. I don't think many people in the United Kingdom listened to Jacinda Ardern's actual broadcasts to the people of New Zealand, telling them how to prepare and encouraging them to stick with it while they got all the way down to 0 cases. That's what we need. Now, I think with Joe Biden on television saying that, he's going to have much more coverage around the world. And just this basic, someone there who is the President of the United States, who is widely respected for his job as President, I think that's going to have an effect, a big sociological effect around the world in the places that aren't complying. And it doesn't going to take much to turn R0 above 1 to R0 below 1, add a vaccine, and you can get, and even it's easily possible just with physical distancing, mask wearing, and then once you've got the cases way down, then doing proper test, trace, isolate, and go in hard and encouraging them, really positive encouragement for quarantine and isolation like they're doing in New York, where if you need to quarantine, you'll get someone to walk your dog for you, take your pet out, and you see you've got plenty to eat, and if they can actually put you up in separate accommodation from the rest of your household, then that would be very excellent. And that would really help a huge amount in reducing the spread as well. So once you've got to small cases in just a few regions, if you've got just 1 or 2 cities, like in summer, we went down to the city of Leicester, you can focus on them and then vaccinate everyone, and then the vaccine is not enough, but do all the other measures they were doing back then, to stop it. It would stop. We came so close to stopping it in the United Kingdom. And then the other factor is, so these are my own ideas, but I see it very positive that I think we're going to end this. I'd be very surprised if we don't end it. I think we've got a good chance of finding a much more effective vaccine at stopping transmission. And they're just being professionally cautious there. But I'd be very surprised if we don't go well above the 59% once we test more different dose regimes and different vaccines and do it properly. And then the other thing is that if we have a vaccine that doesn't stop transmission, and then another thing I was going to say, that 59%, then that is asymptomatic, but it's been the history of the cluster busting for COVID-19, and this would not have worked if there was a very large population of asymptomatic spreaders. So there's a very large population of asymptomatic cases of COVID-19, but at least with the natural disease, there doesn't seem to be a very big population of asymptomatic spreaders. It just wouldn't come down rapidly like that if you're stopping only with at least half asymptomatic asymptomatic, and you only really do this with people who are symptomatic in their contacts, and you can find some asymptomatic people through the contacts. But the way it's going down so quickly, and then actual detailed cluster investigation, for instance in Singapore, it really doesn't look as if the asymptomatic people are doing a lot of spreading with the natural disease. So if that is also true with flu, it is perhaps half as spreading. That would be enough to make that 59% more effective than it seems. But with the COVID-19, then asymptomatic seem to have probably only a small fraction of the transmissibility for some reason. Maybe the symptoms of the cough and so on help to transmit or something. Maybe the symptoms are associated with something that means that they're more transmissible. But for whatever reason, it may well be that the vaccines are more effective than those figures suggest. And then another thing that may make the vaccines more effective is that they've never had to stop a disease that's super spreading. Well, you can't Ebola and SARS, and they're super spreader, and they stop them by test, trace, isolate. But with a vaccine and a large pandemic, and they've never had to stop a pandemic with vaccination, which is spread so much by super spreading. And I don't know, is Ebola super? Sorry, I'm not an expert. I know SARS has lots of super spreaders, so COVID-19, it's very unusual that, for instance, 71% don't spread it to anyone. So if you could manage to vaccinate the 29% that are doing the spreading, for instance, if you're 58% effective, was somehow to work with those or something like that. It's very difficult. The mathematical models are very simple. If you don't have super spreading and it's uniform and random, the population models are not nearly so simple if you've got a lot of super spreading. I don't really know how to model it, and understand some difficulties with modelling it. And so there's all these things. We're really going to be learning on the job to a certain extent, and finding out, if we vaccinate all these people, then does it stop the spreading? And so there's that as well. So we've got this R0 thing, that the R0 is so close to 1, and just having a vaccine even at 58%. So if it's 2.5 or 3 was your R0, then obviously it's going to be very difficult to bring it down. If you get your R0 down to just above 1 by other methods, such as the other control measures that Mike Ryan mentioned, then a vaccine, even at 58%, could make a big difference, stopping 58% of transmission. The vaccines can be much more effective. And then another factor, I think, is that we're going to gradually see more and more countries succeeding. So New Zealand has succeeded, Thailand, Vietnam, China, Taiwan, that's what I meant to say, Laos, and they've all succeeded. They've got Bhutan and North Korea have kept it out. It's reasonably convincing that North Korea have, because they can't be hiding a big epidemic there with lots of them dying and needing ventilators and things. So if we look at that, then if those are all virus free, and then you gradually get more countries join that become virus free, Iceland maybe, or Greece, or Germany, or Ireland, or countries have this decision to make, do we relax or do we go all the way down? And if they go all the way down, they become virus free, and then they can join, and then they'll start wanting to quarantine people going into their countries who are, if the vaccine is not effective in stopping transmission. So if the vaccine is very effective at stopping transmission, then they'll just say, New Zealand will just say, oh, you can come in if you're vaccinated. They might do. They probably would still require quarantine, but if the host country has got very few cases, and then the vaccine is very effective, they might relax their travel restrictions. But we just have to see what happens. But we could well have the situation where we've got two planets really. We've got the New Zealand and Australia. They don't relax their borders because the vaccine is not effective enough. And then other countries eliminate it and then join, and then they can have free travel with New Zealand and Australia, and no longer do free travel with the rest of the world. And countries will have their choice. Which do you do? Do you have free travel with the rest of the world and have these cases continually coming in, or do you have a free travel with Australia, New Zealand, China, Taiwan? And China's quite a big market to have free travel with. If we start having a free travel corridor, say between New Zealand and China, and then gradually that expanded. So it's a question of which way it goes. And so I could see a future where one country after another does eliminate it, and they bring it right down. And I'm not sure if I said that in the United Kingdom we were down to cases per million in Scotland. And if our devolved administration, I think if we'd been an independent country, I think we'd have gone on right down. I think that's and eliminated it completely. It was quite difficult to do it when we had the England really relaxing their measures and Scotland keeping its measures in place for an extra 2 weeks. And eventually we relaxed our measures too, and the cases started going up. And that's basically what happened. And if we brought in test, trace, isolate at that point for the last 2 weeks of lockdown, and ended up the lockdown with nearly everyone isolated or quarantined of the few cases that were left, if we'd done that, we could have probably ended it in the summer in the United Kingdom. And then if we'd been careful about holidays to Spain. So if you look at it like that, we got so close. The World Health Organization say that once you've got to very few cases, go all the way down, like New Zealand did, like Australia did. Once you've done that, then you can let go completely, like New Zealand have done. You don't need to do physical distancing anymore. The prize at the end of that, for an extra 2 weeks, or 3 weeks, or 4 weeks, whatever is needed to completely end it, is very high. And that might be a reason for more countries to join New Zealand, Australia, even if we don't have a very effective vaccine stopping transmission. So I think we could, and then if the snowball rolling, if more and more countries join that, then that could end up even in a condition where other countries are resigning it to be endemic, but half the world is saying we've got rid of it already, and then perhaps you could get the momentum going that way, so that eventually the whole world gets rid of it, even with a not very effective vaccine. But I think that there's a good chance that we do find a very effective vaccine, because it's just so early. It's only such minimal information, and I think that this concern about transmission it's all going to depend on how much of that 1.1 to 1.5 is because of people being very sloppy. So I know, again, from my support of helping people, that people have been very sloppy in London area, in England. The people going around not wearing masks, even shopkeepers not wearing masks, wearing a mask around their chin. No idea what they do, why they do that. And I hear really, stories about care workers and medical workers not taking proper care as well. There's been very sloppy attitude in the United Kingdom, that people just not being given the support of personal protection equipment. Started off very early on with the care homes, of course, and still not that excellent. And and particularly with the general public, if they're out of doors in the street, they don't have physical distancing at all in many parts of the United Kingdom. And they don't seem to understand that it can pass very quickly if you're within half a metre out of doors, if you're not wearing a mask. Yet that hasn't been conveyed to them clearly enough. And you get the people physically distancing inside the shop, and they go outside the shop, and they're chatting away to each other. And it's only gradually being understood, I think, very, very slowly. So if we haven't given it a really fair chance, I think we can definitely stop it like New Zealand did and add a vaccine to that. So if we bring it all the way down and then we really start doing this properly, and the properly supported test, trace, isolate, quarantine, supported isolation, supported quarantine, not penalising people for not isolating, but supporting people and giving them everything they need to be able to isolate effectively, and ideally isolating separate hotels, wards, community centres, and not isolating at home. You wouldn't think of going into a COVID-19 ward and caring for patients without personal protection equipment, and yet so many people at home are caring for someone with COVID-19 without taking any precautions. It doesn't make sense. And especially since the precautions, the knowledge is there about how to do it safely and not run that risk. And so anyway, but so the risk will get less as we all get vaccinated. It won't go away completely through vaccination, especially severe disease. There will be still some possibility, maybe possibilities of deaths, and maybe possibilities of long COVID. So therapeutics will improve over time. It's going to be managed more and more and more, and over the years it's going to become something that's really quite a minor thing. It seems at least possible, by example of OC43. But if we do this really properly and effectively now, we can stop it very much faster, and we either through having a very effective vaccine or through being very careful with public health measures, where we are going to have the constant example of New Zealand. I don't see New Zealand just saying, well, now we've got a vaccine, we're just going to let the virus go through our population. I can't see Jacinda Ardern doing that. So we are going to have New Zealand and Australia and China stay virus-free, while the rest of the world are deciding whether they're going to go virus-free, or whether they're going to let it just be endemic. And I can't see New Zealand saying we're just going to let it be endemic when they've already got rid of it and they're already in that situation. So I think we're going to have that constantly into the future until eventually we either got a very effective vaccine, or the rest of the world gradually eliminates it, or until it becomes a very mild disease, or very effective therapeutics against it, or very effective vaccine against it. But in the meantime, I think that what we certainly will have is a huge reduction in the deaths and serious illness for the next few weeks, and then we can have a huge reduction even with 58% transmissibility, and if we just stay the course, we can definitely bring it down. And then if we can keep the R0, we can just have the patients to do enough measures, and probably just physical distancing plus if you have vaccination. You see, vaccination at 58%, and maybe it's say 50% vaccinated, that'll bring the R0 down to 1.25, or if the R0 increases to 3 because of extra transmission, reduce it to 1.5. And then that's within range by doing things like physical distancing and mask wearing, and the test, trace, isolate, even if it's quite sloppy, we'll be able to bring it right down, and eventually it's gone. If we can keep that number below 1, then it's going to go away. It's mathematically impossible for it to start coming up again without the R0 increasing to above 1. So if you can keep the R0 below 1 all the way down, and you're down to a few dozen cases, if you can keep it at R0 below 1, it'll be gone. It's just mathematically impossible to go up again without the R, because that's just how the R0 is defined. So if you can keep the R0 below 1, and if you can keep it significantly below 1, like 0.5, then it'll go away very quickly. And so that is the meat, and that's the basis of all this. And I think that we are going to do that one way or another next year. And so, yes, and so one more thing, that this bit, it's not necessarily the big one, that they're talking about there could be a much more serious disease. We see, look at how they've it's like a become pandemic, and the world will have to learn to live with it. That's not what Mike Ryan said. He didn't say the world will have to learn to live with it. It might have to. He should have had a might there. The world might have to learn to live with it. And they vary in some saying it's likely, and some say it's less likely to become endemic. And really it's our choice as to whether it becomes endemic. And because it depends on human behaviour. It's not really up to the virus, even with increased transmissibility. And then when they talk about it's not necessarily the big one, there could be one that it spreads as fast as COVID-19, but is much more serious and much more deadly. But the thing is that we would have stopped this long ago if it had been more deadly. If it had been as deadly as Ebola, there's no way that we would have let it spread so far. The world would have been very, very alert. So if it's something as deadly as Ebola in Wuhan in January, then China stopped it throughout the rest of China immediately, because they had experience of SARS. They knew how bad this thing is. And Singapore did. But if it had been as deadly as Ebola, then the rest of the world we wouldn't have tolerated it at all. And we would have just sort of let back and said, oh, we've got 2 or 3 cases, let's do a little bit to try and stop it. We would have been right in there. We would have been doing what Singapore did. We would have tested every single person with flu-like symptoms throughout the United Kingdom if it has been as bad as Ebola. And we would have got a very high mortality rate. We would have tested everyone with flu-like symptoms, and we would have found a way to do it. And we would have done what China did. They had a turnaround time for their PCR tests. Only a few weeks after they'd actually done the first gene sequence, they had a PCR test and turnaround of 4 hours. You could go into a hospital, you could get your PCR test in Wuhan 4 hours after you went in. They didn't let you out again. And then they isolated you in a separate ward if you had COVID-19. And if it had been like Ebola, then we would have been doing the same in the rest of the world. So I don't think that a more deadly disease as transmissible as COVID-19, it wouldn't have spread like COVID-19, because we would have stopped it. And it is entirely because we didn't take it so seriously. That's the reason why it eventually spread to be such a big pandemic and caused so many problems. And because China showed quite definitively they could stop it with the big report on the 25th of February, and the rest of the world had a template then already. 25th of February, absolute definite, you can stop it. And the World Health Organization said that with every single press conference, that we know how to stop this. The window is narrowing, but you can stop it. They would not have been ignored if it had been a more deadly disease. So it was just on the border of being just not deadly enough to be very, very serious, but not quite deadly enough so as to raise the alert systems to the high enough level to stop it. And that's how it got to spread so far. And it only spread amongst countries without the muscle memory of SARS. And the countries with the muscle memory of SARS, they realised this is like SARS, SARS is serious, this is serious, and so they responded very quickly. But ones without that muscle memory, they said, oh, this is like flu isn't serious, this isn't serious, and they didn't respond quickly. So it's all a case of whether the general public thought of it as being like SARS, or they thought of it as being like, or MERS, or whether they thought of it as being like flu. And if the government thought of it as being like flu, or then they just didn't have a very effective response. Whereas if they thought of it as being like SARS or MERS, they did a very effective response and they stopped it. And so that's that bit as well. And then I'll stop with that. So hopefully this gives you a bit more perspective on what Mike Ryan said. And I suggest I'll put a link in the video description. Do have a listen to what Mike Ryan himself said. I agree with some background to help you understand some of the background to what he said. Listen to Mike Ryan himself. Don't listen to what the journalists report him as having said. Have a listen to Mike Ryan himself talking. I've got it transcribed there. It's good to hear him actually talk. Indeed, why not just finish this by playing that back to you.
And I think it's important that we also reflect on the main objective of the vaccine in the first rollout will be to prevent severe illness, prevent deaths, to protect frontline health workers, and to protect the most vulnerable people in our society. And we would hope that protection is offered to health workers and vulnerable people all around the world. So the first and primary objective is to decrease the impact that this disease is having on people's lives. And therefore that will be a major step forward in bringing the world back to some kind of normal. The second phase is then looking at how will this vaccine affect transmission. And Sumi is right, we just don't know enough yet about length of protection and other things to be absolutely able to predict that. But I think we should be able to get good control of the virus. A decision then to move towards elimination or eradication of the virus requires a much higher degree of efficiency and effectiveness in a vaccination program and all of the other control measures. And we still don't know, based on virus evolution, based on so many other things. The likely scenario is the virus will become, as David Heyman said previously, another endemic virus, a virus that will remain somewhat of a threat, but a very low-level threat in the context of an effective global vaccination program. It remains to be seen how well the vaccines are taken up, how close we get to a coverage level that might allow us the opportunity to go for elimination or eradication. We've seen this with polio, we've seen this with measles. Bruce and others online, Anna Maria and others with a lot of experience with measles and polio may be able to speak about this. The existence of a vaccine, even at high efficacy, is no guarantee of eliminating or eradicating an infectious disease. That is a very high bar for us to be able to get over. First and foremost, we have to focus on saving lives, getting good control on this epidemic so our societies can return to normal, and then we will deal with the moonshot of potentially being able to eliminate or eradicate this virus. But at this point, based on the tools we have and the knowledge we have, that's impossible to say at this moment.
So there we are, the moonshot. It's impossible to say at the moment, but we have this moonshot. And of course the moonshot did succeed. So you've got to keep that in mind. I'll upload this.